topic if we have
Yes, sir.
completed the first one?
Yes, sir. The augmented inflow effect, sir. So to start with an introduction, it is going to be during the administration of the inhalational anesthetics. Several factors influence the rate at which the alveolar concentration approaches the inspired concentration. So one such factor is going to be the augmented inflow effect, which contributes to the kinetics of gas uptake, especially when large volumes of gases like nitrous oxide are administered. Of anesthetic gases, which, for example, the nitrous oxide is taken up rapidly from the alveoli into the blood, and a substantial volume of fresh gas flow from the trachea into the alveoli occurs to replace it. So this augmented inflow maintains the alveolar volume and pulls in additional anesthetic molecules from the inspired gas into the alveoli. So the net result is going to be an accelerated rise of alveolar concentration of other anesthetic agents like halothane, sevoflurane, or desflurane. So the relation of this to the other concepts include the concentration effect, where with a higher inspired concentration of gas like nitrous oxide, the alveolar concentration rises more rapidly. So this is partly due to the augmented inflow. And also the second gas effect is going to be the rapid uptake of one gas, which is the nitrous oxide, causes augmented inflow of fresh gas containing other anesthetic agent, which is sevoflurane, desflurane, or other gases. So this enhances the alveolar concentration of the second gas. Thus, augmented inflow effect is a component of both concentration effect and the second gas effect. The stepwise mechanism of this process is nitrous oxide rapidly absorbed into the blood, so which causes a decrease in the alveolar volume. So the fresh gas from the conducting airways maintain the alveolar volume. Along with the volume, this carries the additional anesthetic agent. So this causes alveolar concentration of the anesthetic to rise faster than expected. The clinical relevance of this topic is where it is explained why the nitrous oxide speeds the induction of anesthesia with volatile agents. And this contributes to the rapid FA bar FI rise seen in the practice. And also, this is important during the mask induction in children, where nitrous oxide is often used with sevoflurane to hasten the induction. Also, this is relevant when discontinuing the nitrous oxide. It rapidly wash out can dilute the alveolar oxygen, which can lead to diffusion hypoxia, and which should be prevented by giving 100% O2 or a face mask continuous. So in conclusion, the augmented inflow effect describes the increased entry of fresh gas into the alveoli due to the rapid intake uptake of another gas, which is nitrous oxide. It is one of the mechanisms behind the concentration effect and the second gas effect, thereby accelerating the rise of alveolar anesthetic concentration and hastening the induction while inducing with volatile agents. Thank you, sir.
So will this effect take place if you are inducing a patient with oxygen and air?
No, sir.
Why? Nitrogen also can rapidly go across the alveolar membrane. In fact, faster than the nitrous oxide. Isn't it? Nitrogen also diffuses. What is the purpose of pre-oxygenation?
Denitrogenation, sir.
Denitrogenation. We remove the nitrogen from the body cavities as well as joint spaces, etc. And also the air that is breathing, we have it's 80% nitrogen. So nowadays we try to avoid nitrous oxide. What are the reasons for avoiding nitrous oxide?
It is going to be any closed cavity surgeries like middle ear surgeries, or if the patient
No. The general concept of trying to avoid nitrous oxide in the present day anesthesia.
Greenhouse. It's a greenhouse gas, so because of OT theater pollution and
the gas which increases the global warming effect. Okay, so it is atmospheric escape of nitrous oxide. How long nitrous oxide can stay in the atmosphere?
I'm not sure, sir.
140 years. Can stay in the. And what can it do? How does it cause global warming? What is the importance of ozone layer?
Ozone layer, it's an O3, sir. It blocks the
These suddenly the questions can, especially in the practical exams, the questions can be suddenly diverted towards the greenhouse gases and global warming and why nitrous oxide is being not recommended for routine use nowadays, and why we prefer more of oxygen and air combination as a carrier gas. So that also can be suddenly asked. So the reason for that is nitrous oxide is a very potent, I mean, it can stay in the atmosphere for as long as 140 years. And ozone layer is very, very important for the reflection of UV rays from the sun. Okay? So that is how it prevents the uh, global warming or the atmospheric heat getting increased. And these gases, they make a hole in the ozone layer and allow the UV ray to directly come into the earth. Okay? You have that various layers, the stratosphere, the atmosphere, etc. Like that, there are three different layers. And the ozone layer is the one to cause the reflection of the UV light in the small, almost like a filter to block the unnecessary UV radiation coming in on there. So that is the reason why we don't have to, we are avoiding nitrous oxide as much as possible, even though it has got some analgesic property and causes this sort of faster induction by getting absorbed faster into the bloodstream and causing a negative pressure in the alveoli. That is the important point that has to be mentioned. So when you induce a patient by inhalation induction using oxygen, nitrous oxide, and a volatile anesthetic agent, the nitrous oxide diffuses faster into the bloodstream, creating a negative pressure. So that draws more of all the inhaled anesthetic agents. And during that process, the anesthetic agent gets concentrated in the alveoli. So that helps in the diffusion because it is based on the concentration gradient only. So it causes a faster diffusion of the anesthetic agent, which is called the second gas effect. This terminology, augmented inflow effect, was not there in the earlier textbooks. It was only the concentration effect and second gas effect, which were described. But this term has been included in the recent mechanics of inhalation anesthesia. They have included this term to indicate that the presence of nitrous oxide draws in more of the inhaled anesthetic agent and the oxygen, and the whole mixture is drawn inside. That is the reason why they have included this terminology. So it is nothing but the old wine in the new bottle, the same concentration effect and second gas effect has been explained by the indrawing of the mixture of inhalation agents delivered by the machine faster into the alveolar tube. That is the reason for that. Okay, so both the topics have been described well by you.